All right, so today we're going over the muscles and actions of the spine and thorax. So very important with posture, with movement. I mean, this is the core of your body. So like I said before, looking at the entire human and looking at all the muscles of the core and torso is going to be very overwhelming. So if we break it down into movements, we can group the muscles together and it's easier to learn and remember. So first action we're going to go through is spinal flexion. So most of us in the world are stuck in this position because we're leaning forward, looking at our phone, sitting in a couch, in a chair, at our desk. We're constantly leaning forward. So the abdominal wall and cavity can be kind of stuck in this position. So we're looking at the external obliques on the outside. So oblique is like going on an angle, on an echelon. Okay. So we have external obliques because it's on the outside. And you see how it wraps all the way around from the sternum and rib cage down to the pelvis, all along the pelvis and coming up to the back of the ribs. So this is the encasement of our core. Then if we go underneath, then we get to our rectus abdominis, our quote unquote abs that we see when somebody has a six-pack. And again, this is enclosing you from your rib cage down to your pubic bone. Okay, so we have the rectus abdominis. Then to the side, we have our internal oblique. So you can think of the internal oblique, the striations go into your back pocket. So if you're putting your hand in your back pocket, that's going to be the internal oblique. If you're putting your hand in your front pocket, that's going to be the external oblique. Okay. And a lot of times when you're working with a client and they have back pain and tension of the core, so the muscles of the back are typically going to be tight and elongated, and then the muscles of the abdomen are going to be compressed. So when you come into the side body and work in the side body here, it's going to really relieve a lot of that tension of that abdominal cavity and tension on the back here. So working the side is going to be very, very beneficial than just working the posterior chain. Next, we're going into extension. This is what we need to do more of to counteract all of the contraction of the abdominal cavity in the chest. As you can see how this rises and falls, this ribcage rises and falls, you need to rise and fall as you breathe, as your diaphragm expands and contracts. The more contracted forward we are in flexion, the more or the less air you're going to get in your lungs, and that can contribute to more brain fog, to less oxygen going to your brain, to the actual breathing into your belly. People start to breathe into their chest and become chest breathers. Okay, so when going up a flight of stairs, if you're not getting enough oxygen, of course you're going to get more lightheaded more easily. So having people go more into extension, encourage them to go more into extension and getting proper stretching exercise and getting proper positioning of the spine when they're sitting and laying and driving and all that. So extension, We have all these muscles that are going up along the spine to bring that rib cage, head, and neck back in one sequence, right? You don't want to just kind of flop that head over and the neck over. You want it all to come back evenly. So the muscles are going to run from the cranium, and then they're going to run down and kind of attach to the spine and go all the way down to your sacrum. So let's start from the outside first, these little wing-looking muscles. So this is your iliocostalis, coming from the ilium here up to the costals, which are your ribs. Hence the name iliocostalis, putting it together. You have different sections of this. You have the lumborum, which is attached to the lumbar spine. You have the thoracis, which is attached to the thoracic spine. Then we have the cervicus, which is going up and attaching up into the cervical spine. Okay. Then going more medially, we have longissimus. So just think of a long muscle that goes all the way up the rear of your back. All right. And then let's take these out. That out. Now, even closer, we have spinalis. So if you look really closely, you can see how these kind of they ladder up the spine, up the spinous processes. It goes from here down in L3, and then it rides all the way up and connects to T10. So it's going to kind of ladder and cross each other so that with tension, you have stability of the entire chain. All these discs are moving in sequence together. All right, and then going up, starting at T6 and going up to the cranium, we have splenius cervicus. Okay, so cervicus referring to the cervical spine. So this is running all the way up to, pause that, all the way up to your atlas. So you can see if you had a lot of back pain in the middle of your back, if these muscles are pulling here on your neck, then you can tend to have a headache right under your ears. You get this tension right under your ears there. Okay. Then break that off. Then we have splenius capitis. Just think of it going to the edge of a baseball cap. Your cranium is the cap of your head. Okay, so all these muscles in the back, the more we lean forward and more we're watching our phones and leaning forward and working on our computers, the more these muscles have to tighten to hold this skull up from gravity pulling it down forward. Every inch forward is, it doubles the pressure of the discs here. So the more you're forward, the squeeze, 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 squeeze. And because your brainstem runs down through there, the more forward, the more issues you're going to have with headaches, with migraines, with cognitive disorders. You're going to have, facial distortions. The more pressure you put on the brainstem, the worse it gets. And the worse your balance gets too, because your proprioception is off as well. So we want to encourage them to bring their head back. If it's tight in here, what happens if we relax these muscles? They're already stretched out. If we relax them more, then the head's going to fall even more forward. So we're going to work with the muscles on the front part of the body, on the front side of the chest, shoulders, and then the lateral side of the cervical spine to help bring that head backwards and encourage that extension. So right now, most people's ropes are pulling in the front side, and these muscles are straining to try and pull that body back upright from this flex position. And again, you can see the spinalis muscles. You got spinalis thoracis, then you got semispinalis thoracis, then you have semispinalis capitis, okay, and then in front of that, you have capitis as well. So it's just the lateral and medial portions of this. But again, these are coming from each individual vertebra. It's like scaffolding coming up, like you're holding up a tent. You want to hold everything in place, all these stakes in place, so that the spine can move as one full unit. Very important. Okay. And again, this chain can be tight from the back of your head all the way down the middle of your spine, all the way down to your sacrum. So if a client doesn't have mobility in the hips, they don't have mobility, or their head is strained forward, it's going to pull all the way down that chain. So working from the sacrum all the way up to the back of the head when you're working the spine. Now we're looking at lateral flexion. Okay. So this is lateral flexion to the same side. These muscles are contracting, pulling the body to one side. The opposite side is going into extension. So if we're sitting and we're leaning to one side for long periods of time, then that's going to lean our center of gravity to one side. Sitting in a couch, slump, having one kind of leg up and leaning in your car on the armrest or on the window. So like if we're not sitting up straight for the majority of our day, we can get stuck in these positions and it can pull us down. And when it pulls us down, it brings the rib cage closer to the pelvis, and that can actually impact the lower leg and lift that lower leg up, because it lifts the pelvis up, giving the client a short leg, which impedes gait and different things, many different things. So we're looking at the largest muscles first. So we're looking at the lat dorsi. Okay. Contracting down. Under the lat dorsi. We're looking at these spinal muscles on one side. So remember, we have the iliocostalis, bringing the ribs closer to the ilium. All right. All of these spinal muscles to hold all these vertebrae in place to flex it. So kind of like a snake moving, it's like everything moves together. We have our external obliques, right? Holding that abdominal wall together while it's bringing the ribs closer down. And like I said, if somebody has back pain and they have a hip imbalance, you're going to see that you can fit only so many fingers on one side in between the rib cage and the pelvis, and on the other side you're going to fit more fingers in when you press into the lateral body. And you can see that one side is really contracted, which is going to again pull on this lumbar spine, putting pressure on these vertebrae that's uneven and it's not returning to its natural position. We have our internal obliques, and then we have our quadratus lumborum. So quad meaning 4, and it's attached to the lumbar spine. So you're going to hear a lot of people come in and say, my chiropractor doctor said you need to really work that QL. It gets really tight. So as you can see, all of these larger muscles are supposed to be working first. If this smaller muscle, this QL here, does more than its job, like if it's tagging in and it's doing a big muscle's job, it's going to fatigue out and it's going to cramp up and lock up. So if people have weakness in the abdominals, then the back has to take the support of the rib cage and start working. So all of these muscles are going to be tight and fatigued and sore because a person is weak in the abdominal cavity to hold this entire cage together. All right, next looking at rotation. Again, properly rotate the rib cage or the spine, we need to have stability in the abdominal wall to hold the rib cage and turn it like a corkscrew. If there's any weakness and imbalance, then any turning is going to be kind of wobbly and it's going to put more stress on this spine, which if there's more stress on the spine, these muscles are going to clamp down to help protect the spinal cord. And then you're going to have chronic tension. And when you go across this back, it's going to feel like you're going over train tracks, like it's going to just rock hard. So the multifidi here, because they're attached from spinous process. So let's see here. These go from spinous process to the transverse process and above, like in a cross pattern. And what it does is it's going to slightly pivot and rotate the vertebra just slightly as the rib cage moves. So there's this like slight rotation, but everything rotates properly. Like one vertebra doesn't rotate more than another one because we have these muscles, the multifidi that actually go up and hold these muscles together. You also have the rotatories, which are smaller muscles underneath here that are keeping this spine stable as it twists. But the majority of the movement of rotation is going to be, like I said, in the abdominal cavity and in the internal and external obliques. So that's why if you're doing activity like exercise, the Russian twists are really good. Doing around the world with kettlebells to force the weight to go around the body to stabilize these muscles so that your whole core stays tight, and these larger muscles here take pressure and do the work and not put the work onto these smaller muscles, which can cause that tightness and then cause bulging disc and herniations and all this stuff long term. Okay, now we're going up into the rib cage. Like I said before, with inhalation and exhalation, this rib cage needs to be in its anatomical position. These intercostals in between the ribs, these are going to hold the ribs and lift the ribs up. Okay, you see how it lifts and expands open like a flower at the bottom of the ribs. This is going to allow the diaphragm to drop down and allow more space inside for your lungs to expand and bring in more oxygen. The more oxygen you get, the more oxygen goes into your blood, goes to your cells for repair, goes to your brain for function. It's just our body needs oxygen to do everything. It's our part of our fuel system. So if somebody's leaning forward and they're a chest breather and they have back pain and they have problems breathing from the diaphragm, then we can actually work the intercostals here to help loosen them up, to help that rib cage expand. We can work in here in the abdomen to help the diaphragm have space to contract and expand. Okay, so bringing this thorax back, bringing the head back is going to help them be able to breathe. If you lean your head forward and try and take a deep breath in your stomach, it's very difficult. But if you bring the head back, you can take a deep breath. So if your client comes in like, man, I just have like brain fog after work, my eyes hurt, my neck hurts, and you can see that they're leaning forward, you're like, your brain is not getting enough oxygen. Your muscles are fatiguing because they're trying to hold the head up from falling over into your keyboard all day long. So we need to relax the muscles to bring the body back, an extension, and then provide support in your chair so you can sit up and relax in this supportive position. And then you can breathe and you're getting more oxygen and you're not fading out where you need to drink Coca-Colas and coffees just to get through to like 4 o'clock. If we look up here, we have the scalenes. Again, scalenes like a scaffold. These are holding up the tent, the circus tent, in the middle of the circus tent, so that your neck is supported. The more forward that neck is, the more on stretch these muscles are going to be. And the more tension is going to pull down on the cervical spine where your brainstem comes down through. So the more tension you have on the brainstem, like I said, you're gonna start having more cognitive issues. So working the scalenes under the traps through the neck, this is going to be easier to work when they're in the supine position, and you can actually move the neck around to get your fingers into those muscles, to really work those muscles all the way down to this first rib. It might be very sensitive for a lot of people if they've been stuck in this forward head carriage, but if you can work it without them being so reactive, then it's really going to give a lot of relief to that neck. And it's going to really just take off a lot of stress. Okay. And then lastly, we have rib depression. Okay. So the diaphragm, same thing, it's going to expand and then it's going to contract. If the muscles are tight and holding the rib cage open, then we're not going to be able to get a good release. So then we're not going to get enough CO2 out of our blood, and then that blood pH goes up, and then we have problems. So we need to have this open expansion, just like those old school, I don't know what they're called, but like when you watch like Scrooge and he's like lighting the fire and he's got the and he's pushing the fire. It's like that accordion, opens and closes. If not, it's not going to suck in air or it's not going to blow air into the fire. So again, if the client is leaning forward, then all the muscles on the back chain are going to be very tight and elongated, pinching on the nervous system and on the circulatory system, kinking the hose, and the brain's going to put on that check engine light and say, hey, let's put on the pain response because something is not flowing here properly in the back. So we don't go in and just start digging elbows into the back. We want to increase circulation, but we want to restore the posture by going to the front body and bringing as much of those contracted muscles back so that the posture can go back to this normal positioning. And then when we work the back area more, we're going to actually get more circulation, more oxygen to those tissues. And then the nervous system is going to say, hey, we're getting what we need. We can turn off that check engine light. We can reduce that pain signal because we're actually getting the proper flow again.